Good afternoon. Thank you for inviting me to present in this webinar. I am Roberta Said, and today I will be talking about the research I carried out as part of my master's, entitled Communication Training for Informal Caregivers of Persons with Dementia in a Rehabilitation Setting. So this is an overview of my presentation. And first, I will be starting off with definition of dementia as stated by the World Health Organization. Dementia is a chronic progressive condition which affects cognitive function beyond what might be expected from normal aging. It affects, obviously, processes of memory, language, calculation, and capacity and judgment. This also, in turn, affects how a person is able to emotionally control their behavior, their social behavior, and their motivation. Throughout my literature search, I obviously looked into how this condition affects, this situation affects language, and it creates these common communication difficulties, including word-finding difficulties, decreased verbal fluency, and difficulties in understanding and using complex language forms. By language forms, I am referring to sarcasm, metaphors, similes, which is more abstract language, the more abstract language we use when we are communicating. Obviously, these language difficulties may hence result in relationship strain between both the caregiver and the person with dementia, which then affects their physical and emotional health, and their caregiver, which can then lead to caregiver stress and burden. So the purpose of my study was to identify whether information sessions given within the rehab hospital to caregivers helps them with developing better abilities in conversing with their relatives with dementia. So my method will be discussing these points. So my study design included a pre and post comparison study, whereby I utilized conversation analysis to analyze transcripts gathered from caregivers before they attended the information sessions and after they attended the information sessions, which obviously were aimed at enhancing knowledge on dementia. So basically, the information sessions consisted of 12 talks given out by various professionals, including a physiotherapist, an occupational therapist, a speech therapist, a pharmacist, a geriatrician, a doctor, and some support groups who help out persons with dementia and their caregivers locally. This is how I gathered my participants. In all, there were 12 caregivers attending these information sessions, 9 of which were chosen once the inclusion criteria were applied. So the inclusion criteria included caregivers having to attend information sessions and them and their relatives not attending speech therapy. 3 of these dropped out prior to giving consent, and then this resulted in 6 caregivers being chosen together with the person with dementia. No dropouts occurred through the study and the period of data collection. Within this group of persons, 3 persons with dementia had early stage dementia, and another 3 had moderate stage dementia. It is important to note as well that whilst the caregivers were attending information sessions, the persons with dementia were attending activities to enhance their daily living skills and their interaction. No, their daily living skills as well as their memory. So the data collection included 3 home visits, whereby within the first home visit, the researcher collected some demographic data, as well as explained how the recording was going to be carried out. And during the second and third home visit, there were the audio recordings. Now, during the audio recordings, the researcher left the recorder within the participant's home, left for 10 to 12 minutes, and then returned to collect the recorder. So this was done so that conversation wasn't influenced by the researcher, and it was as spontaneous as possible. Tips were given on how tips to the caregivers was given on how they can initiate conversation, and 10 to 12 minutes was chosen because according to research, this is the best, the most ideal period of time where a person with dementia can continue a conversation in view of their difficulties with attention and language stimulation. The researcher also attended the information sessions, however, she did not contribute within the sessions, not to influence the speakers and the participants who were attending. Data analysis included the following areas. These are CA conventions used when analyzing transcripts. There was overlapping speech. Cut-offs, by cut-offs I mean when one starts talking and another person immediately starts talking at the same time. Pauses, latching, when one person doesn't give the other person time to stop and therefore the conversation doesn't pause. Intonation, loudness, and whispered speech. Other descriptors were turn taking, topic management, sequence organization, and repairs. By sequence organization, I mean like when one asks a question and another responds. So that question answer pattern is a sequence organization. And intonation and loudness markings were also annotated using a specific program. Now, intonation within the transcripts is going to be annotated by an arrow up when intonation increases and an arrow down when it decreases. The following ethical considerations were employed. Obviously, there was informed consent from participants. Proxy consent was used when persons with moderate stage dementia were participating, and the necessary information was always presented prior to consent being given from the participants for them not to be coerced within the research. So the results were the following. So 6 common talk practices were identified at maintaining communication. The 2 most common ones identified prior to the information sessions included information seeking questions followed by pauses and positive feedback, and listener feedback, also referred to as other repair, followed by a decrease in intonation. And the 4 talk practices after the information sessions included topic shift, followed by information seeking questions, followed by pauses, statements providing additional information, also referred to as announcements, statements to initiate participation in conversation, also referred to as invitations, and statements eliciting correct information, also referred to as complaints. Now we're going to go through these talk practices within snippets of conversation analyzed. This memory chart, I found that this memory chart was a good way of explaining how possibly these talk practices might have helped the person with dementia access language and whilst they were conversing. So the first technique, the first talk practice, as already stated, was information seeking questions followed by pauses and positive feedback. And this transcript is between a husband and a wife, the husband being the person in the moderate stage of the condition. So within the transcript, you can see the turn number, which is indicated by numbers. D1 is usually referring to the person with dementia, and P usually refers to the caregiver, with the CA connotation being described next to each turn. So within this snippet of conversation, the caregiver was trying to help the person with dementia identify where he was in a photo she was showing him. So he is asking her Is it me? So this is like a question for further clarification. Clarification seeking question as identified CSQ. And she accepts, she tells him yes. And then he points to another person in the photo and he tells her, and my dad. And she replies, which one are you? And here we can see also a sequence organization being formed. A question and an answer, that's an adjacency pair. And he tells her this one and he points to the person in the photo. And she refuses, she tells him, no, that's not you. So that's a downward intonation as can be seen by the arrow. And there's a pause, 2 seconds. And he tries to other initiating repair. He tries to repair this one. And she then accepts, this one is you. And then she asks him another question. And she tells him, and this one. And he accepts then and says, my dad. And then she provides the feedback overlap. In Maltese, when we use this kind of feedback overlap, it generally helps the listener further contribute to a conversation. And then she asks another question, and he replies, me with R. And she again encourages him to continue. She gives him that acceptance that he correctly answered her reply. And then he asks a question himself. He tells her, and who is she? S? And he tells her again, look, this one's the young one. So here, as you can see, he further contributed to the conversation himself without being prompted. And she replied, I think so, I think that's them. Now we're going to look at the second talk practice identified prior to the information sessions, which is listener feedback, also referred to other repair by followed by a decrease in intonation. So here we have a snippet of speech between the daughter and her mom, and she's trying to help her mom remember how old she is. Now within this snippet of conversation, we can see how the person with dementia who is in the moderate stages uses humor to sort of cover up her inability to remember how old she is, which is usually accessed through a person's short-term memory. So the person with dementia tells her, my goodness, then I must be double your age. And the caregiver tells her, you are not double my age, but my age and another half my age. And then the person with dementia says, and so it doesn't matter that you are double my age. And the caregiver tells her, not I. And there's a Mushian, that means that the caregiver was using a louder voice. And the person with dementia starts to laugh and says, I am. And she says, I am. There's an increase in intonation. And the caregiver tells her, you are older than me. And the person with dementia tells her, so what if I am double your age? And then the caregiver realizes that she needs to give her more information for her to remember the requested info. And she tells him, you are 89 years old. There is a decrease in intonation there. Okay. Now we're going to start looking at the talk practices identified post the information sessions. So here we can see a topic shift followed by an information seeking question followed by a pause. So it's a snippet of conversation between a husband and a wife, where the wife is the person with moderate early stage dementia, and her husband is trying to make her remember the researcher's name. So there's a topic shift to introduce a new topic, and he tells her, okay, now, do you know what her name is? And she uses an open class repair initiator, OCRI. This is usually used by a person with dementia when they want to know more information with regards to what is requested of them. And they usually involve the words of what, when, why, who. And she tells him what. There's a small pause. That's the full stop. And the caregiver tells her, he tries to ask her a question and do another initiated repair, so that he tries to help her continue conversing. He forgot her name, and she again here asks him, what is it? It's like she wasn't really listening to what he was telling her. What is it? Like when someone's saying something and you need a repetition, what is it? Pardon? And he tells her, what is her name? And then he has to tell her she can't remember. And he tells her her name, and then she repeats the name. But then she realizes that this name is the same name of another person she knows. So he tells her, that's another one, because one is R and so is the other. And then she self-initiates a repair, because R, yes, the other. So she's remembering that there's another person called the same in the same way. Yes, is the other one too. And then the caregiver accepts this and says, yes, the other one too. Now we're going to talk about statements providing additional information, also referred to as announcements. And within this snippet of conversation, we have three individuals. We have the person with dementia. Actually, we have two individuals, sorry. We have the person with dementia and the caregiver, who are husband and wife. And the husband is trying to help the person with dementia remember how many pills he needs to take according to the date. Within this snippet of conversation, a calendar is being used as a visual. So it starts with an information seeking question, asking her, can't you see what the date is? And she tells him yes. And he tells her, so Wednesday, what is the date today? Another initiated repair. So it gives her more information, gives her the day. And she accepts and tells him, so today it's the 30th. And he then repeats, so it's Wednesday 30th. And she says, okay. And he then tells her, so how many warfarin pills do I need to take? And she accepts that information and tells him 3, and 3 tomorrow. Okay, that's it then. It's another announcement. So basically, here we are seeing how this additional information is helping the person with dementia access her procedural memory, which is usually a part of the long-term memory, and is usually preserved. And it's usually something which persons with dementia have are more able to access because it's preserved for a longer period of time. Now we're going to look at how invitations were used to initiate participation in conversations. And this conversation is between a daughter and her dad, who is the person with early stage dementia, and she is trying to ask him whether he'd like to eat his lunch by the beach. So they are at home and they're planning to go to the beach, and she's asking him whether she wants to take a packed lunch, whether they want a packed lunch with them. So she starts by introducing a topic and inviting him to go to eat by the beach. If you like, I already prepared lunch. I can bring it along and you can eat it there. Would you like that? And he refuses to tell her, no, 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 no. And then she invites him again and she tells him, you eat lunch here then, at home, she means. And he accepts it and tells her, then I'll come. And she interrupts that turn. That's why there are those equal signs. This is the latching. Since, and he tries to ask a question to clarify what he's hearing. We'll be coming here to eat later, right? And she repairs by saying, and yes, we'll be coming back here, but after you usually feel sleepy and you wouldn't feel like eating later. So let me read. And yes, we'll be coming back here, but after you usually feel sleepy and you wouldn't feel like eating. There's a small pause later, and he states an announcement, but I don't want to eat early right now. And she tells him, no, not now. I will bring lunch with me. Okay, so he's a bit confused. He doesn't know whether they're going to eat or not, and whether it's going to be by the beach or at home. And he tells her, oh. And she tells him, at the beach, you can eat there, next to the sea. And then she invites him again, because today you've got salad, pasta salad. She gives him more information. A self-initiated repair from her part. Would you like to do that or? And he refuses, tells her, oh, no, since then it will get cold. And that. And she accepts. So here we can see how a topic shift and an invitation helped the conversation progress further. So as we can see, it started off with an invitation on the topic initiator, and obviously then there were more turns as it got along, as the conversation went along. Now we're going to go over to complaints, and we're going to see how statements eliciting correct information helped between the couple who we've already experienced a snippet of their conversation earlier on in this presentation. It was between the husband and the wife, where the husband is experiencing moderate stage dementia. And she's trying to make him aware of the researcher's name, whether he still remembers the researcher's name. So she starts off by telling him, don't you know who she is? It's like a complaint to elicit more information from him. Didn't you tell her that you know her? And he refuses. He says, meaning no. And then she states, she tells him, you recognize who she is. And he tries to justify why he's not remembering her name. That's because she comes here. And she tells him the name, R. And then he justifies his lack of knowledge of the name. That's because she comes here, though. So he's trying to tell her, I remember her face, but not the name. And she tells him she came here on another occasion. And he accepts it, tells her, Okay, so as you can see through these snippets of conversations and these talk practices, the caregivers helped the person with dementia further contribute to a conversation. Coming back to sample size and maintenance of talk practices, these were the two factors I identified, which could have been a limitation to the study, in that the sample size was rather small, and there were no follow-up sessions to check for maintenance of these talk practices. So future research can look into a larger sample size and maybe follow-up sessions of both these talk practices, as well as maybe talk practices which might be used with persons who are in the later stages of dementia, so they might change. And I would like to end my presentation with this statement. To effectively communicate, we must realize that we are all different in the way we perceive the world, and use this understanding as a guide to our communication with others. And here is my email should anybody have any questions. And these two references are the main references where you can access my research. Maybe read more in depth on the different aspects discussed of my references and bibliography. Thank you for listening, and I hope you found this presentation interesting.